All right, thank you. Hello, everybody. My name is Choi, and I work for the LightHouse of the Blind. And my job title is Deaf-Blind Specialist. I am deaf myself, and I have an interpreter, Stevie, across from me, who is voicing as I sign. Okay. My coworker is his name is Shen Kwan. He is blind, and he is a trainer for this program. So he's here to help me answer some questions. So you may be wondering how this National Deaf-Blind Equipment Distribution Program, or the NDBEDP acronym, started. If you're hearing, you can use a phone to call anybody at any time, but a deaf-blind person can't access that equipment. You know, they don't really have that kind of access. So the FCC decided to serve deaf-blind people with equipment that was specifically related to telecommunication needs in long-distance communication. This started in 2012. The program was established in 2010, but it was actually put into process in July of 2012. There are many other states that are, in many other states, they call this program the iCanConnect. In California, we call it the National Deaf-Blind Equipment Distribution Program, but other states you'll see it referred to as the iCanConnect. So you may be wondering who's eligible for getting this equipment, and there's a whole step-by-step to the process. In America, there's several 100,000 people who both have hearing and vision loss or impairment. There are some people who probably don't come forward and say, you know, I cannot see or hear. They don't self-identify. Numbers, you know, we continue to advertise and to do outreach to try to find these people and bring them in. If you have both vision and hearing loss, then sometimes you don't have access to the information. Here in San Francisco, it's been really amazing. We started doing outreach, and people in San Francisco, they were 40, 50 years old. They had never heard of the LightHouse, believe it or not, and we're right here in San Francisco. You know, and you just imagine they were missing about what's happening in the world because they didn't have access to it. And they might come into the LightHouse from family, friends, neighbors who might have given them that information and then brought them to the LightHouse. Okay, I was talking about who qualifies for this program. You have to live in the United States, and you have to meet the federal poverty level guidelines. You have to meet both, and you have to be both hearing and visually impaired. So there are three things that determine eligibility. First, you have to have hearing and vision loss, and it's got to be significant. And we follow the Helen Keller National Center guidelines about vision loss and measuring vision loss. So the vision loss has to be 20/200 or above, which means you're legally blind or you have more vision loss than legal blindness. For hearing loss, it's a little bit trickier to measure. Some people will say, well, I have a hearing loss, but when you ask for their audiogram, they might present a different picture. So when somebody applies, they fill out the application form, and it will ask for a physician's signature. It could be a doctor, it could be a social worker, it could be a rehab counselor. Any of these people could sign this form. If the applicant is a LightHouse client, then that means we have their vision and hearing reports here, and they don't have to go through getting them again. And I would not, in that case, need a doctor's signature because they're already in our system. If the person is new and we don't have any information on them in the LightHouse, then they can get the doctor to sign. And they also need to have a vision and a hearing report. The reason for this is because a lot of doctors really don't understand about legal blindness. Sometimes a doctor will sign it, and if I look for the vision report, they'll say things like, well, the person is blind, legally blind in one eye. And that, that really doesn't mean that they're legally blind, according to our definition. So then it requires me calling the doctor just to clarify that the person only has sight, in one eye but not in the other, and that person isn't qualified as legally blind, as deaf-blind in this program, for this program. For hearing loss, if a person has vision loss and hearing loss, it really impacts their lives. So we get the information, we get information about the world through both senses, both our eyes and our ears. If you have vision problems, you really depend on your hearing more. So when we get an application, we oftentimes do an assessment to make sure that the person has real needs in both vision and hearing. Most of the time, this is true about the people who apply. Usually we're looking at people with moderate hearing loss. They can hear maybe some, but they're missing a lot. So that type of person would meet the qualification. Now, the income qualification, you see 2015, the federal poverty line, the federal poverty level numbers on the slide. Most deaf-blind people are living on probably SSI. Some people do work. So we do look at the family income as a whole, not just the individual who's applying. And if the family income is above the poverty line, then we have to turn them down. In general, we do accept most of the applicants. The other qualification is that people must have the potential to use this equipment. So here in California, we want to make sure that our clients get the right equipment for them and that they're able to use them. Not just that they're going to get the equipment and it's going to end up in a closet somewhere collecting a lot of dust. So for that reason, we do a very thorough assessment. And we make sure that they get training with the equipment. For example, if we have somebody who has never used a computer before and they want a computer, well, they've got to learn how to use a computer. And that takes a long time for many people. And we don't have that kind of training time. The FCC gives us very limited hours, and it's only in the telecommunication area. So the training would include FaceTime, Skype, emailing. We basically have 10 hours of training available for each client who gets the equipment. Sometimes we can expand it to 20, but people who have never used a computer and need 50, 100 hours of training, that's just not possible through this program. So if you have a consumer who wants to use a computer, I need to make sure that they have support if they don't know how to use the equipment. Sometimes we refer a client to rehab, and rehab can come, Voc Rehab can come, give them the basic training. And once they're computer savvy, they can get this equipment. Or they might have a family member who can train them and can help them on an ongoing basis with anything that they need. Also, many times we can connect people to community support. For example, there might be a person in the community who, has become a real expert in using the Braille display, and they don't mind being available to teach that to a deafblind person. So that's why in California, this program is more than just providing equipment. It's more like doing some social work, some real social work and community building with people. It takes a lot of time and a lot of good work. Sometimes there is no equipment available, either because the person might have a developmental delay, or they might be, over 85, or they might not see well enough or not be able to learn Braille. And, that might be an impediment. We do provide phones, and we expect people to be able to pay the monthly premium plan of the phone. If they can't afford to pay a monthly fee for the phone, they would need to have Wi-Fi access. So we do consider many, many things. This isn't just a simple yes or no decision. Are there any questions?
This is Kim. I'm breaking in real quick because it looks like we've got a couple of questions. So, they just popped up.
I'm not seeing them on
They just popped up. If an individual has roommates, how is income figured?
So the question about roommates, are they family members or just roommates?
Kim, again, can you address both?
If they're just roommates, they aren't included. If they're family members and they live in the house and they're part of the household income, they're included in that. If they're just, they're not going to include a boyfriend or a girlfriend, or just a roommate is not going to be included in the household income. This is the interpreter just asking for clarification. Is this a question about the household income? Oh, I see. So he's reading other people on the lease. If they're not family members, they're not counted. It's only if they're related, if they're family members, that they would be included in the household.
Okay, Kim, again, I'm going to jump back up to another question. Are we getting to the types of equipment available later? I'm guessing yes, but is that correct?
Oh, yes, definitely, yes. So $20 million is in this, the FCC grant every year for the entire U.S. In California, we get $870,000. This is the 4th year, and in the 4th year, we've gotten $874,147 for the 4th year. So that's starting July and ending June. That's the way that they're counting the fiscal year for this grant. So the program started in July of 2012, so this is the 4th year of the program. We just went into the 4th year. So you might wonder about how that money is distributed. I mean, that's, $874,000, to California. I mean, we do a lot of paperwork, a lot of admin. We have to buy the equipment, train trainers, and then we have to bill the FCC every 3 months. We send in a detailed equipment accounting. It's a lot of work. It's a lot of paperwork. I'm just laughing because it's a lot of work. And you have to be exact. One time, I worked on all of the budget, and we were off 1 cent. Seriously, 1 penny. And they wouldn't accept the report until we found the 1 penny. I was shocked. I had to look for that 1 penny and fix the mistake. So it's very strenuous. I'm laughing because it was funny in hindsight. Also, you've got to have a justification for the equipment. Otherwise, the FCC will get in touch with me and want to know what the person uses it for. And I have to give them a detailed justification. So, I know, I'm laughing, but I love this program. And the reason why is because I see that it's really life-changing for so many people. And I'll give you a few examples of that later. It touches your heart to see how getting this equipment and this training changes people's lives. Okay, so in year 1, we got 181 applications, and we served 169 people. And you think, we had more applications than people we served, and some people sent their applications in June, so they didn't get served until the next year. Because there were some people, we would get their applications, and then we had trouble contacting them to set up assessments. You might say, well, why couldn't you contact them? Well, for a deaf-blind individual who can't hear or see the phone ringing, who doesn't have an email system at home, sometimes contacting them presents a big challenge. And, it really takes a village. Sometimes we had to go to another agency that they were affiliated with and ask them to check on them and set up a home visit. It can be quite complicated. Also, some applicants, who sent in applications weren't qualified, and they weren't ready. Like I explained before, they might not have had the basic technological skills, so we had to hold on to the assessment and maybe do it the next year and wait for them to get that basic training. So that's why the numbers aren't, you don't see 181 applications and 181 people served. In year 2, we had some people from the year before, year 1, who got equipment, and then some people got additional equipment. Like they might have a computer, that was working fine. They just needed a phone to go with it. And then maybe a few months later, their computer broke and they had to reapply. So that's why the numbers aren't exact. That's because we got 24 people carried over from year 1 into year 2. I'm getting a question. So the comment says, the cost seems to be a lot for staff time just to find the missing penny. Yes. I mean, a lot of that is the 15% of the total grant every year is administration cost. So that's 15%. When we started the program, a lot of states wanted to get into it, but many of them dropped out as the years went on. We had quite a few states that dropped out because there's so much administration work. And a lot of the states didn't have the backup money to buy the equipment and pay for the trainers. And then because you have to wait several months to get reimbursed from the program, from the federal government. So you need a cache of money as a backup. And many states didn't have that. Okay, so now we're on to year 3. And we've got 83 applications and 124 people served. And 46 were from the previous year. So we've already had 20 people apply, and this is the 4th year. Many people might wonder, well, if I get the equipment, is that it? Can I never get it again? And you can apply again. States set up their own policies in regards to that. Here in California, what we say is if you get the equipment, you really have to wait. Our policy is you wait 3 years. And because that's pretty much 3 years is the lifespan of a lot of the technological equipment. Some can last for longer than that, and some, will just break down. And then the person has to apply again. If your vision or hearing changes, then of course the person can apply again. For example, if a person is able to use a screen magnifier and read on the screen in the computer, and then they find over the year their vision loss is greater and they have to convert to Braille, then of course we'll do an assessment and take into account the additional vision loss and the need to use Braille. Also, with phones, for people who had enough hearing to use the phone, and a lot of times their hearing loss is greater, then we do an assessment and we can pick out the equipment that's more adaptable for them. So if the phone is still good and the person can no longer use it, we ask that they return it to the program. If the phone doesn't work anymore, then we record that as a loss. These are California statistics in the National Deafblind Equipment Distribution Program. In California, so if you think about how many people are deaf and how many people are hard of hearing, that's what this pie chart shows. So the ASL users are 35%, and blind or low vision or hard of hearing are 65% of the people who are participating in this program. This is a pie chart of demographics of participants, and there are more women than men. So women are 55%, and the men are 45% of the participants in this program. Ages of participants served, 15 to 35 is 15%. The next category is 36 to 55 is 30%. 56 to 70, 45%, and above 70 is 10%. So in general, the 35 to 70 is the largest percentile asking for equipment. This program does not have an age limit. I mean, if somebody were 10 and can use the equipment, they can apply. But you have to remember that schools are responsible for providing equipment to the children who attend them. We don't provide equipment to schools. For that, we usually refer people to rehab. A lot of times the schools say, well, we'd like to give them equipment so they can practice typing, and they want us to provide that, a computer for that or other equipment for that, and we say, really, that's back on them. That's their responsibility. The next slide is this program's geographics. Northern California is 35% of the participants are from Northern California, and 65% come from Southern California. There are many, we think that's because there are many retired people and senior citizens who live in Southern California because it's warmer. That's a joke. It might be true. What did you say? What? I might move there, Shen says. Yeah, Shen says he might move to Southern California. Northern California is very expensive as well, so that might have something to do with it. And we're still finding deafblind people here. You know, it's almost like they're hidden. I mean, 2-3 years later, we're still adjusting this geographical data. The deafblind program here in California is not just run by the LightHouse for the Blind. We partner with the Helen Keller National Center. Are you aware of the Helen Keller National Center in New York? The Helen Keller National Center has a Southwest region that's in San Diego, in Southern California. Some people know about the Helen Keller Center. Okay, so there's a woman who represents them, and her name is Kathy Kirshner. She covers Southern California, the Southern California region for the Helen Keller National Center. And we partner together in the FCC program. This is the part that most of you were curious about. What is the equipment that's available? Computers. We have Windows and Apple available. We have desktops, laptops. In this program, we tend to get medium-priced computers and equipment. We don't go for the really cheap ones or the really expensive ones. The really inexpensive ones will break down, and so we go for a medium, good quality equipment. For example, MacBook Pro, iMac 21 or 27-inch screens. And we always add, they always come with warranty. But we expect the participants to keep up the warranty so that if the computer breaks down, they will be responsible for getting in touch with the Apple Store to either get it repaired or replaced under the warranty. Some people keep up with the warranty and some people don't. Some participants know what to do, or they have a family member help them. We do have a lot of participants who are isolated and live alone and might not have the help that they need to bring something to a store and get it repaired. So sometimes we step in and help out with that and teach them how to take care of getting their computers repaired. It's slow, but we're making a lot of progress in that area. We also provide large monitors if needed. You know, it depends on what the applicants need. Most of the time, we provide 24-inch monitors. But we can also provide 27-inch. Sometimes we've provided up to 70-inch, if you can imagine. Okay, somebody's asking about the iPhone. Yep, I'm going to get to the iPhone. So you might wonder why somebody would need such a large 70-inch screen. For the VP phones that deaf people use, a 27-inch, especially with visual impairment, doesn't work. They can't see the signing. People who have optic atrophy need to go close up, but they can't sit far away. So they always ask for, so they might ask for a 70-inch screen in order to access the video phone and talk to people using sign. And we order those and we actually install them. So that's when the FCC gets in touch with me right away and says, why are you ordering a 70-inch screen? So I send them a long email explaining why, and that's always accepted once they get the reasoning behind it. Okay, somebody's asking a question about the small numbers of deafblind people in the world, in the country, and are there companies enough willing to make equipment for them? And it's difficult because companies are in it for a profit and the numbers of deafblind people is small. So we do research. We get a regular Braille display piece of equipment and we try to figure out if it works for a deafblind person, then we use that. We've also been in touch with the Apple Store and been, you know, negotiating with them, and they've actually been listening to the possibility of maybe making some changes and making their equipment adaptable for deafblind users. And change is slow. The Braille display itself, companies are willing to add the features that a deafblind person, a user, would need. They haven't made a lot of changes, but some companies have made some small changes that have been effective. The next question is, with the Bluetooth, is it compatible and to a hearing aid? So we don't provide hearing aids, but we do provide an FM system. And it's got to be compatible with the Bluetooth and the Bluetooth hearing aid. There's one FM system. It's called Pleo. We've got one. Yeah, we haven't really evaluated it. We're asking an audiologist to look at it and see if it'll work. So that, you know, because we want to provide an FM system that's compatible. So the audiologist, waiting for the audiologist's recommendation. It's got to come from the person's audiologist. We've provided that Bluetooth Compliant system to 4 people so far. And it's worked. for them. So if it works for the clients, then we will provide it. But it's got to be for telecommunication purposes. That's the added step. A lot of people ask what CCTV is, and they ask about that. I think at the beginning of the program, there were other states that were providing CCTVs with large screens. They said that they were plugging an iPhone into the CCTV in order to read it. We don't do that in California. It didn't make any sense for me, so I felt that I couldn't really justify giving CCTVs out for that. I mean, because, you know, why not just use a computer with a large monitor? Because you'd have to get the iPhone with the cord and the CCTV and set it up, and it just seemed more complicated than it was worth. But we do provide small magnifiers. So if a person uses a fax machine, for instance, you know, you'd get like the fax machine, you know, if you get the fax and you can't read it, then we provide the magnifiers, the handheld magnifiers for them to be able to read it. Because then you can, you know, you have to use your judgment in a lot of these cases. If a client needs a big CCTV, I would probably refer them to their rehab counselor. I also think last year the FCC, it was funny, the FCC was checking out the clients who were asking CCTVs and asking them how they were using it. And the answers were things like, oh, it's so cool, I'm reading my mail, I'm reading my medicine bottles, and that's, you know, that doesn't fit the definition of telecommunications. So now it seems that even fewer states are distributing the CCTVs. Again, you have to use good judgment in the equipment that is distributed. And it's really got to be for telecommunication purposes. And I think somebody's sending a question. Hold on. Right. That's true. Bluetooth compatibility does help maintain privacy. And, you know, you can use headphones with the iPhones as well. And then you don't have, you know, you don't have the speaker going, so that would be more private as well. I'm not sure, I'm getting a question that says what the other purposes are that are included, and I'm not sure what the question is. Can you just clarify that question? Purposes are included under Okay, so the question says, what other purposes are included under telecommunication? And I'm not sure what that means. I mean, if it means what telecommunication means, it means things like making phone calls, like using a video phone if you're deaf, email, using the Braille display, going on Google, FaceTime, Google Talk. I'm sorry, what did you say? Shen says instant message. AOL, all of the ways that you would hook up with people using telecommunications. That's all included in telecommunications. I don't know if that answered your question. I mean, the email is pretty basic. Texting is included, FaceTime. If you want to use it for webinars, that could be added on. People get an iPhone, and they use it for maps, they use it for weather. I mean, we don't give it for specific uses like using it as a map, but they're using it for texting, they're using it for email. If they want to add on uses like weather or maps or pictures, that's fine. I mean, but that's technically, that's not telecommunication. I mean, they have to be using it for texting and emails, looking things up on the web, that kind of stuff. I mean, why not use it for webinars? I mean, if they want to add that on as a use, that's fine. So the question, I'm getting a question that says why computers are needed instead of just a smartphone then. Because of the Braille display. Smartphones and the iPhones are limited. I mean, they're good for travel, you know, to go out into the community. They're not so great for long Braille messaging. I mean, you would use your computer at home. Like in California, we give 2 pieces of equipment. One is for home use, and the other one is meant for community travel purposes.
This is Shen. I wanted to add that another reason to consider a computer is think about what the person's skill is already. They may be able to use a computer much more quickly than learning another device. So remember, going back to what we were talking about, the limited number of hours of training per person, that's really important.
Suki says, yeah, right, that's true. Thank you, Shen. All right, mobile devices, cell phones, smartphones, tablets. Cell phones have quite a variety. For example, we have the Odin visually impaired talking phone. It's very simple to use. If somebody just wants to simply use a phone, we give them that one and we train them on how to work it. Some people only want a BlackBerry, and that's fine. We have that. We also provide the Jitterbug phone, and those are just some of the examples of the cell phones. Now, the smartphones, you know, the iPhone is the one that's the most popular. The iPhone 6 or 6 Plus is the one that we distribute, and also the Samsung Galaxy. We buy an unlocked phone, meaning that you don't need the 2-year contract, and then we pay full price. So if you have a contract for 2 years, you know, with AT&T, then you might be paying about $300, and we buy the full price phone, plus we add on the Apple Care, and I think the total might be over $1,000 for the phone. We pick one with medium gigabytes, so we really go for the middle of the road gigabytes. 64 gigabytes is pretty much our medium. We also provide tablets. The iPad, of course, is the most popular. We have other tablets, but nobody's really requested them yet. Mostly people are looking for iPads. So they get the iPhone, the iPad, and then we add accessories like a screen protector, a case, and we don't buy just any case. We pick cases that will really protect a dropped phone and be durable. I want to tell one funny story. So equipment is very expensive, as we all know. And when we give somebody the equipment, we explain our policy. And we say the equipment is now yours, and we expect you to take care of it. And that means you don't sell it, or you don't give it to your family member. This is meant to be yours for telecommunication purposes, and we go over with them. And a few months ago, I had one deafblind individual who lives in Southern California, and they were using a Mac laptop, a MacBook Pro, at a coffee shop. Some guy came over and started beating on this person who was using it and stole the MacBook Pro. And it was on the news. It was terrible. The police got the culprit, but unfortunately the MacBook Pro was gone, long gone. And in a situation like that, I asked to get the police report, and I showed it to the FCC, and they approved to provide a replacement for the deafblind individual. So, I just emphasize maybe use your judgment where you use this. So, we had another consumer who had an iPhone, and they gave it to their girlfriend as a present. And then he said, "Oh, I lost my iPhone." I said, "Well," I said, "you're responsible for replacing it." I mean, people have to understand that they're getting the equipment free. You can't really abuse the privilege. The question is, do some states not participate in the program? There are 50 states. It doesn't matter where you live. You can apply for the program. In California, we only control California. There are some states that have joined together with a few smaller other states, but most states are under Perkins School for the Blind in Massachusetts. So that means the states don't apply. Perkins has sort of taken over the program from those states. So if a person wants to apply to the FCC program and they're wondering who to contact, then they should contact iCanConnect, and that program will look at where you live and then refer you to the correct state coordinator. So there's a question about what are the considerations for an iPhone or an iPad. It really depends on the consumer's needs. They have to have good enough vision for the iPhone. If they have good enough vision for the iPhone, then they can use that. They have to be able to pay the monthly bill themselves. For the iPad, they can use Wi-Fi, so they don't have to, have a monthly premium. Going on to landline phones, I've never gotten a landline phone request. I mean, if they're asking for phones, we usually have a conversation about it, and most people who if they need a landline, then they go to the California Telephone Access Program, or CTAP, and they can get a free phone. So if they can't, then if CTAP was not going to give them a phone, then they can come back to us and we would provide them with a landline. So signalers is the next equipment, and we do provide signalers. If a phone is ringing, either a light flashing device or a vibrating device for someone who's deaf and blind, will alert them on an incoming call. Software to make the computer accessible. We have screen readers like JAWS, Window Eyes, Dolphin Guide, and Zoom Text. If a client already has something such as JAWS, but it's old, then we will upgrade them. Also keyboards. We can provide bigger keyboards for people. The next category is Braille devices. That's our most expensive category. Braille display with maybe 14 cells costs about $1,500. And they get bigger than that. They can go up to $4,000 for the larger ones with more cells. So the Braille displays, we have quite a few. The most popular one is the Focus 14 or the Focus 40. We also have the Smart Beetle the Vario Ultra 20 or 40. We have one called the Brilliant 40. We also have multi-purpose standalone Braille devices like Braille note takers. That can cost up to $6,000, but we still will provide it if the person can benefit from the device for telecommunication purposes. I'm getting a question. So the question is, what kind of hearing loss would a blind person need to have to qualify? And it's really hard to measure. I think 30 decibels dB loss or above. But that's just a general estimate. It's picture time. One thing that I'm very proud of here in the California FCC program is that we hire deafblind people to train deafblind people. We also hire people who are hearing. We don't discriminate, but we also hire people who are blind in hearing and deaf and blind to be our trainers. We also hire people who will provide transportation for our trainers, and we hire interpreters. So this picture shows a deafblind man who's working with an iPhone and a Focus 14 and being trained on that equipment. And you can see there's one individual with who's hard of hearing who has got a hearing aid. This shows a lot of, the second slide shows a lot of the different equipment. It's all based on the assessment of the individual and their needs. There's just not one size fits all. On the right, it shows a variety of the Braille display devices. On the left is the iPad with the Braille Edge Braille display, and then there's the Braille Sense on the right. This next one is the iPad. So when a client gets an iPad, we provide a keyboard as well, unless they say that they don't need it. But we will provide a keyboard and headset so that they can hear the voice better. The voiceover, sorry. And on the right is the iPad mini with, it should be Jawbone, and anyway, it's a speaker. It's an external speaker. This slide shows, I've done the Focus 14 is 14 cells, and it's really good as a Braille display. It's good for portability and travel. The computer will have 40 cells, so it's larger and less portable. This shows somebody being trained on the Focus with email. I want to share one story. Sometimes deaf people losing their vision have a very hard time, and they really are resistant to learning Braille because a lot of times learning Braille is signifies that they've accepted that they're going to be blind, and that's very difficult for a deaf individual. So they'll get by trying to read, with screen magnifiers and Zoom text, and I'll send them an email, and then I'll wait a week for a response, and I know they can't read it. So I'll do an assessment, and I'll say, what about the Braille display with an iPhone? And if they don't know Braille, I send them the Braille book, and I ask them to work with it for 2 weeks. We don't do the Braille training ourselves. They have to learn through other resources. There were two of our clients are sisters, and they're both deafblind, and they couldn't see well enough to use the computers anymore. So I gave them the Braille book, and they together practiced for 2 weeks. I flew down to where they were. I got the iPhone with the Braille display. I showed them how to text and email. It was slow, but they were doing okay with the Braille that they had learned for 2 weeks. And what happened? It was amazing. They were emailing and texting back and forth in instants. It was amazing. It was wonderful to see. I mean, they were crying because they were so happy because they were just, they just were isolated. They couldn't contact their families. They were just dependent on rides. The driver would drop them off sometimes in the wrong place, and they couldn't contact their family to say where they were. Now, with the iPhone and the Braille display, they can check where they are. They just check the map. They say to their husband, "Oh, I'll be back." They send him a text and they say, "I'll be there. I should be there in 5 minutes. This is the street we're on." It's been life-changing for them. And they're constantly texting me. It's wonderful. We text back and forth all the time. They've reached out to their friends. They had been so withdrawn from friends. They had no way of communicating, They would email and nobody would get back to them, or they couldn't read the emails. And now they're in instant communication with all of their people and their families. This screen shows different low vision solutions. And this next screen shows the LightHouse trainers, a deafblind person training a deafblind person. And if you ever wondered what Sookie looks like, there I am standing in the picture on the right. I'm the short one. And this is more training in tech centers and at home. And this is just, training and recipients receive a minimum of 10 hours of training. And these are all recipients from California, connecting with family and friends. I'm very proud of California because we have worked extremely hard to change people's lives. And the deafblind people deserve it. They deserve to be in contact with the world. So thank you, and thank you for participating in this webinar. And if you have any questions, feel free to contact me.